Hello. Thank you for joining us and tuning in to this recording. We will be discussing how human service agencies can coordinate and integrate their services to improve family experiences and outcomes. My name's Kate Steepleton. I'm a principal associate with MEF Associates, as well as the director of our Children and Families domain. My colleagues and I are excited to share information and resources with you today in this recording. To begin, I'll be providing some background information about a project focused on supporting human services agencies pursuing coordination and integration. My colleagues, Lisa Rao and Eleanor Pratt, will then go into greater detail about what we produced and what we learned during this project. Lisa will walk us through a toolkit of curated resources for administrators, and Eleanor will describe how we worked with and learned from 7 pilot sites to advance coordination efforts and refine the toolkit. Finally, Rekha Balu will discuss how a focus on family experiences and family engagement can ground coordination efforts and increase the chances that they will lead to meaningful changes for families. So, let's go ahead and dive in. Anyone working with families or in human services agencies knows that there's a sizable subset of children and adults that are accessing multiple safety net programs, such as temporary assistance for needy families or TANF, childcare subsidies, food assistance, and more. The U.S. Department of Health and Human Services found that in 2019, 12% of adults and 33% of children received services for more than one safety net program. Even more are eligible and might benefit from participation in multiple programs, but for a variety of reasons, including administrative issues, they don't access them. As we all know, however, safety net programs are often siloed or only minimally aligned. They often have different eligibility rules, different application procedures, fragmented renewal processes, differing requirements, and more. Some of these are driven by policies and regulations, and others are the result of programmatic choices over the years. The result of this is a siloed approach that families really have to that requires families to navigate a complex network of programs, accessing services through different entry points, having to tell their stories repeatedly, which can be re-traumatizing, engaging with multiple workers, having to understand benefit interactions, and so on. This can really limit access for families that are interacting with or who could benefit from multiple social safety net programs. Meanwhile, efforts to coordinate and integrate human services programs can mitigate some of these challenges. Thoughtfully designed and implemented, these efforts can increase access to benefits for participants, increase the efficiency with which programs operate, decrease burdens on participants. They can be more responsive to the needs of all household and family members, and by extension, improve outcomes for the families and children served. Recognizing all of this, MEF, with partners at the Urban Institute and the Adjacent Possible, embarked on a project over the last year and a half to improve coordination and collaboration among human services programs, with a focus on improving the experiences of families involved with multiple programs. There are a few reasons we focused on improving family experiences and why we encourage agencies to do the same. Doing so allows partners to come together around shared goals. It keeps the focus on families and attention on the outcomes that matter most. And it necessitates the engagement of families and lifting up the voices of families in the change process. The project had 2 interrelated activities that are described here on this slide. These activities happened in parallel and informed one another throughout. First, we recognize that there are many, many tools out there to support coordination and integration efforts, but they often are targeted at a particular aspect of coordination. They focus on a single system or are otherwise too narrow to apply across multiple settings. What we did is carefully curate what's out there and present it in the context of a new roadmap for coordination, complemented with new tested tools. For example, we developed tools to help partners identify a shared vision and engage in action planning in the early stages of coordination. Over the months that we were developing the toolkit, we refined it with input from teams around the country. Specifically, we worked with 7 sites on coordination pilots over 9 months, providing customized coaching to the site teams. We used tools and draft modules from our toolkit in our coaching and gathered feedback from the folks we worked with to further shape and improve the toolkit. Eleanor will share more about the pilots and what we learned from them later in our presentation. But for now, I'm happy to turn the mic over to Lisa Rao to share more information about the toolkit.
Thank you, Kate, for sharing some background on the project and teeing up my walkthrough of the Coordinating to Improve Family Experiences Toolkit. To get started, I want to ground all of you in how you might think about approaching the toolkit, the different sections of the toolkit, and the resources that are contained inside them. So the Coordinating to Improve Family Experiences Toolkit is comprised of an introduction and 5 modules. Although they can be used in any order, and to the extent that's useful for your context, the intention of the order of these modules is closely aligned with a kind of common continuous improvement cycle. You'll learn a little bit more about that cycle and how our pilot sites worked through those phases a little later on with my colleague Eleanor. So the first module really is focusing on helping teams identify their vision for improving the experiences of families when accessing multiple benefits programs and pinpointing a focus for improvement. Module 2 connects that focus and specifically the pain points that families experience when engaging with multiple programs to potential coordination strategies. Modules 3 and 4 lay out coordination guidance, tools and examples, best practices to support the success of teams taking on coordination, and areas where teams can build their capacity to coordinate through other organizational changes. Module 5 supports teams in identifying metrics to monitor their implementation and outcomes of their coordination effort and to plan for continuous improvement. Now that you have a sense of the toolkit structure, we wanted to share more about specific information and resources you can find in each section, along with a few examples from our pilot. So Module 1 contains a number of activities to support you on your use of the rest of the toolkit. It begins with several reflective activities to help your team think about what you know about current experiences of families in your programs, their goals in accessing services, and then develop a vision within your team, first of all, on what you're looking for once those experiences are improved in the future. So really thinking about your vision for what experiences will look like later on. Next, the module provides guidance on developing a service blueprint, which I'll talk about a bit more in a moment, to clearly map out current processes and their components, and then identify issue pain points for families and based on their experiences with those processes. Finally, users of the Module 1 are guided through a process of developing a problem statement based off of the pain points that you've identified, then validating that problem statement using root cause analysis. So as I mentioned, a central activity in Module 1 is the service blueprint. This visual is a very simple example of a service blueprint that's provided in the toolkit, capturing the actions of families, the ways they connect with frontline staff, the actions of those staff when meeting with families, and then also kind of the work they do behind the scenes or the backstage of their work, and any processes or systems that support that work. Finally, the blueprint is annotated at the top. It's really highlighting it as an important feature. Families' emotions and feelings as they're interacting with those processes and taking those actions. Those elements of the service blueprint should really be driven by information gathered directly from families. This tool is useful to push you and your team to look not only at the way you think about processes, but breaking it down into its components to really help you pinpoint what is driving experiences of families and the issues they're facing. One of our pilot sites, the New Mexico team used an activity very similar to the service blueprint as we were developing the toolkit to identify pain points and their connections between TANF and child support for families who were working to meet their child support cooperation requirements for TANF. The team identified this connection and the confusion for families when taking steps to meet those requirements as a major pinpoint. And that was really informed by previous family engagement work that they'd taken on prior to the pilot. Their team identified a need for individuals within their agency who understood both program requirements on the TANF side and the child support side quite deeply. And so they identified a goal to cross-train staff and ensure those staff have authorized access to both program systems to support families before they run into issues and really avoid non-compliance issues related to child support cooperation. Module 2 is intentionally quite simple, really just trying to help connect you as you're using the toolkit from those pain points you identified to potential strategies. It's really a guide to helping you think about how to access and use the remaining sections of the toolkit. The pain points and the strategies within them are organized into 3 categories. We've described them as program level problems, application eligibility determination and renewal problems, and service level problems. So those program level problems are those that are more structural elements of programs, such as the location of services and infrastructure for communication. Those focused on application eligibility determination and renewal are kind of grouped together in the toolkit because they often involve related or connected processes and systems. Finally, service level problems are those that involved direct interactions with families, such as case management approaches that programs might be taking on. Module 3 is, well, you'll find the kind of meat of the toolkit where there are resources aimed at supporting users to finalize their implementation plans and taking steps to move those plans forward. It begins with several activities that the team can use to help them finalize their planning, including an activity to support prioritization based on expected impact and feasibility, an activity to check that the strategy or strategies that you've selected respond to the goals that the team established. So these are images or examples of those 2 activities, impact feasibility matrix and an activity called a so that chain so that you can kind of connect your strategy back to your original goals and vision. Finally, there is some guidance there on turning back to that service blueprint approach that I mentioned previously, but mapping out what the future might look like when a strategy is implemented. So resources to support implementation are organized into 19 coordination strategy profiles, including both a synthesis of major elements of each strategy shown here. So we have an example of physical co-location, moving offices and service access to the same place. So this is just a snapshot of the toolkit showing some of that synthesis and guidance for thinking through what implementation looks like. There is also a number of external resources to support implementation. So this is really just straight from the toolkit, one of the examples of the strategies. Wanted to share just an example about how one of our pilot sites, the team from Louisiana, leveraged the resources specifically for this strategy. So they came into our pilot with kind of physical co-location, moving program services into the same location for service access. They were working on bringing TANF, workforce, and other human services programs into a central location as a pilot. And this work to implement their co-location pilot, they did use these resources to identify a number of other critical coordination changes they needed to make to fully realize their goals. Those included coordinating their intake processes and needs assessments, improving their referral processes, and coordinating their case management strategy across programs, and developing and implementing data procedures to facilitate each of those three other changes that I mentioned. Module 4 touches on coordination best practices. These are best practices that our team derived from our scan of literature early on. That was the basis for a lot of the content and structure of the toolkit. These include guidance on why those practices are critical and how teams can think about implementing them. So this slide shows our kind of synthesis of these best practices, including developing a shared vision, and this is a shared vision beyond your team, but for your combined organizations as you work together, really elevating family perspectives and voice in your coordination efforts, developing a culture that promotes change and continuous improvement. And that is across both or all kind of programs, agencies that are involved, if there's two or more. Building and reinforcing relationships kind of at the individual level, but then also establishing collective shared ownership of the work as the way to keep the teams connected. Clearly articulating roles and responsibilities amongst team members, and developing consistent communication practices that reinforce those roles and responsibilities. And then finally, as a good intro to Module 5, thinking about and building in plans to measure success and focusing on continuous improvement. These are all really key practices that we found for successful coordination efforts from other examples. Additionally, Module 4 does include resources and guidance on additional organizational changes that support coordination, but don't on their own improve the experiences of families across multiple programs. So there are other changes such as data sharing, data infrastructure changes that aren't directly impacting families, if you're thinking about that service blueprint that I was talking about earlier, but are really creating a foundation for coordinating to better serve families across programs. Module 5 provides guidance for establishing plans for continuous improvement beyond your initial coordination effort, and identifying metrics to monitor both the implementation or output from your coordination work and the outcomes. So this is just a table that provides some guidance and examples about what we're talking about when we're talking about output and outcome metrics, and some examples of thinking about qualitative and quantitative data. So some teams might be really new to thinking about this. This really just sets a really strong foundation for thinking about how you're going to monitor your work. Additionally, Module 5 includes a number of specific metric examples with guidance on thinking about who is impacted, including larger systems impacts, program level impacts, impacts to staff and their work, how they do their work, and ultimately impacts on family experiences. This table here includes metric examples for coordinated referrals, including examples of both quantitative and qualitative data that your team could collect to capture these metrics. And finally, the toolkit is paired with a really comprehensive facilitation guide that can be used by internal or external facilitators that are supporting your team's coordination effort. This facilitation guide includes deeper guidance to support facilitation of activities that are already in the toolkit, some additional activities to meet unique needs of teams that maybe are ready to dig a little deeper, have more time to dig in, as well as worksheets to structure those discussions. I've just included an example of a worksheet, really helping teams connect that prioritization for that impact feasibility matrix to specific actions that the team can take to really jumpstart implementation. That was my thorough walkthrough of the toolkit. I'm really excited to hand things off to my colleague, Eleanor Pratt, who's going to tell you all some more exciting things about what we learned and did with the pilot sites.
Thank you, Lisa. So again, I'm Eleanor Pratt. I'm a senior research associate at the Urban Institute. And I served as the lead coach for 2 of the 7 pilot sites and led our efforts to understand and capture learnings across the sites. So I'm really excited to share key lessons from the pilot sites with you today. I want to start with what brought sites to the pilot. What did sites hope to get from this toolkit and to accomplish with their coordination efforts? Across the board, sites recognize that even if their programs were housed in the same department or agency, they may not work closely together, and there could be gaps in communication, understanding, processes, data systems. As one staff member put it, we're in the same building, but that doesn't mean we work together. And sites had many of the same motivations and goals for using the toolkit to improve coordination, including identifying stakeholders that needed to be at the table. In one site, the team realized in working together that they needed to be working directly with contracted service providers and not necessarily with the state agency staff themselves. Sites were also interested in improving communication with other programs. In one site, this looked like developing materials for staff to better understand partner programs. Another site was interested in improving their reputation and facilitating access to benefits. Some staff recognized that families often experience a disjointed system and that they don't necessarily care if staff are part of one program or another. From a family perspective, they may just see the Department of Children and Families or the Department of Human Services. And so staff recognized that in order to improve their program's reputation and to build trust with families, they needed to be better coordinated with programs across the department. And then finally, this timely access to benefits for families being reintegrated is an example of one of the hoped for better outcomes for families as a result of better coordination. So we worked with 7 sites: Hawaii, Washington, New Mexico, Tennessee, Kansas, Louisiana, and Jefferson County, Colorado. And these sites had a number of kind of a variety of areas of focus. And I'll just share briefly what they were broadly focused on. So in Washington, the Department of Social and Health Services focused on coordination within local planning area partnerships, which include local and state agencies, community colleges, nonprofits, and other partners focused on serving TANF recipients. They piloted this work with one local planning area and had began to work with another. In Jefferson County, Colorado, they focused on coordinated program access and service delivery through co-location and policy alignment across several human services programs and workforce programs. In New Mexico, the Healthcare Authority and the Work and Family Support Division focused on TANF and child support coordination, as Lisa mentioned, and navigating the process between those 2 offices. And in Hawaii, the Department of Human Services focused on service coordination for pre-adoptive and pre-guardianship families. In Kansas, the focus was on families being reunified after out-of-home placement in the child welfare system, and they focused on one 5-county region with the goal of ultimately expanding statewide. In Tennessee, the Department of Human Services coordination focused on the local level, coordination between government, faith-based, and community partners in a 3-county area. And then Louisiana focused on co-location of TANF and workforce services at American Job Centers in one local workforce development area. So you can see there was a wide variety of geographies, programs, family experiences of focus, and chosen strategies. Sites worked with teams of coaches who supported them through the toolkit and led them through facilitated activities and identified resources of particular interest and value to sites. We recommend the sequencing on this next slide for any team using the toolkit. As Lisa mentioned earlier, this is the continuous quality improvement framework, modified slightly to be specific to the toolkit, where first you began with identifying a vision for whole family services. As Lisa discussed in Module 1, pilot teams identified a family experience, defined a problem affecting that experience, and then reflected on current processes related to that experience. Then in the planning phase, teams identified a coordination strategy to pursue, and they prepared for implementation. And then finally, site teams began to implement the strategy and to refine their approach over time. It's important to know that each site in the pilot progressed at a different pace. For many, the first phase, that identifying a vision for whole family services, the work in Module 1, lasted for most of our 9-month pilot period, as the teams worked to establish foundational elements of their coordination effort, and some did not reach the implementation and monitoring stage during our engagement. Sites with a clear direction coming into the project moved more quickly, but still needed to go through each of the phases and to spend time with Module 1 to set themselves up for success. Over our 9 months working together with pilot sites, we learned a great deal about what hinders or facilitates coordination efforts. And I want to share with you 3 core themes that we recommend toolkit users consider. The first is staff time, attention, and leadership, then relationships among the coordination team, and finally, buy-in, authority, and direction. I'll start with staff time, attention, and leadership. We found that teams with a staff member who had dedicated time, focus, and authority to lead the coordination effort were able to get further faster than sites with no clear leader for that effort. We also found that the role of the facilitator was critical to success. In the pilot, the coaches played the role of facilitator, providing guidance, structure, and group facilitation. A resounding theme across sites was that the value in coaching could not be overstated. This doesn't mean, however, that the facilitator has to be external or can't be an internal staff member, but it is important to identify a facilitator who can be neutral and respected by all partners to mitigate power imbalances that might exist between partners, and a facilitator who is somewhat knowledgeable about the core programs involved. We also found that it was really important to understand the history of challenges between programs or even specific staff. Were there tense relationships where partners could be bringing in negative experiences, emotions, or perceptions of each other? Conversely, if partners had a history of collaborating positively, that helped facilitate the work. It's also important to understand failed partnerships or collaboration efforts. A number of sites in the pilot raised how past attempts at better coordination did not take off, or past pilots took a lot of effort from staff and did not ultimately pay off. That can hinder coordination efforts if partners feel like this is not worth their time. Across sites, we also saw some struggle with the fundamental lack of understanding between programs. Staff may not understand what another program does, but especially they may not understand program goals or what motivates another program staff. They may not see the constraints and challenges that staff in another program face. For example, in one site, they found that the workforce funding is so complex, and partners in other service programs did not always understand or appreciate that complexity. So to address this history of challenges, this potential lack of understanding, we found that the best approach was to center family experience, which my colleague Reika will talk about more in the final portion of the webinar. By focusing on a family and the challenges that they face interacting with programs, staff can approach questions with curiosity and seeking understanding instead of blaming. And this is why the toolkit strongly emphasizes spending the time to understand family experiences and to map current processes in Module 1. This approach also helps sites to identify and include the right people, the people who understand the problem, the people who can make the change, and the people who deal with the problem every day. Across sites, we thought it was critical to bring in frontline staff and participants as possible. As one site member said, the further you get from direct service, the less you see the core problems. We also saw sites engage new and sometimes unexpected partners, especially non-governmental partners. Finally, I want to share a bit about buy-in, authority, and direction. Buy-in is that shared vision, the shared desire and willingness to change, and having enough trust to change. Authority is around the ability to make decisions and to move forward. And finally, direction is alignment on objectives and the path, or in this case, the coordination strategy, to get there. All sites struggled with one of these, if not all, and all teams needed some of all three in order to be successful. We know that change cannot happen and will not stick without some level of buy-in from stakeholders. But with buy-in and no authority, sites can't make real changes. And with buy-in and authority, but no direction, sites knew where they wanted to go, but could not get clear or align on what they would do to get there. In the pilots, we found that you can build buy-in by including partners in the process of developing a shared vision from the very beginning, and that by starting from that space of visioning allows an openness for participants to consider new possibilities and points of view. And then going to the process mapping, that understanding of what is actually happening, can help partners to understand each other and to build trust within your coordination team. On authority, without the authority to make decisions, coordination efforts will stall. So the coordination team must have sufficient authority in order to make changes. Finally, direction. Building consensus around a shared vision takes time, and picking a specific strategy to move forward also takes time. As one site leader put it, talking about what you will actually do, can get scary because it's about accountability. We found that having a small pilot can get people on board faster because of experiential learning, the practical application of the tools from the toolkit, and the facilitation of that human connection between people doing important work in the service of the same overall vision for families. I hope these lessons from the pilot will help you and your coordination team as you open the toolkit and start your own coordination effort. Next up, it's my pleasure to introduce Reika Valu, Vice President of the Center for Equity and Community Impact in the Research to Action Lab at Urban. We'll share more on family engagement.
Thank you so much, Eleanor and Lisa and Kate. I want to really pick up on 2 points that were in Eleanor's last slides there. One about them being the importance of identifying and including the right people in the conversation to really understand what is a whole family experience, what is it to be involved in and apply for and receive multiple social safety net programs at the same time. And who knows that better than the families themselves? And that relates to the point that Eleanor just finished making around buy-in, authority, and direction, which is if those people who know that experience best, the families themselves who've been participating in and receiving these programs, are part of the decision-making process, are given authority to offer their insights and experience and their recommendations, it can actually help accelerate the kind of continuous improvement process that Lisa and Eleanor were describing. So that's a little bit of what I'm going to talk about today. The opportunity we had with these pilot sites was to do more than just talk to families. So more than just the occasional survey, the customer experience survey, or a research interview, or a public hearing, where maybe people come and relay their opinion, but there isn't an exchange. What we mean when we say family engagement is really talking about this ongoing consultation with the people involved in and affected by the programs in the ways that Eleanor was just describing, with that kind of decision-making authority and direction and alignment on objectives. And this ongoing consultation with families who have been or continue to be involved in benefits programs in formats where they can actually make recommendations and decisions was the goal in some ways of even the service blueprint idea that Lisa had described before. In that top row of that blueprint where you see family experiences and family frustrations with the process, the goal is really to get to the bottom and the root cause of those frustrations and barriers to understand how to resolve those for a more simplified, streamlined, or productive and engaging experience. In many of the pilot sites that we worked in, this was an interest from the agency program director, from the agency caseworkers, and others. We noticed that only some of the agencies had an existing family engagement mechanism in place, like a family advisory board or similar method. And those that had an ongoing family advisory board were able to more quickly seek out not only family opinions, but also really hear deeper experiences and recommendations that then they were able to integrate into policy or program changes more rapidly. Agencies that were just sort of beginning to think about this family engagement approach and process and are still setting up their process were not able to move as quickly. And so one of these lessons from the sites, to add to the lessons that Eleanor was mentioning is that it may be helpful when embarking on this kind of coordination experience or coordination exercise within a social services or human services agency to be thinking about what the family advising and family engagement structure might be that can go alongside that. In the absence of having this kind of family advisory board in every one of the sites that we worked with in this project, we had recruited a set of family consultants who had experience with receiving and delivering benefits, such as TANF, child welfare, child support, foster care, and made it easier to connect with them as a kind of short-term proxy for the ongoing family engagement that agencies might eventually pursue. Part of what we learned when those family consultants were working with or talking with or providing insights to the caseworkers and program administrators is that being able to see these family needs and barriers and frustrations that families face when they're having to provide information to multiple benefit programs were often similar concerns that caseworkers or administrators might have. They might show up at different times in the process, but engaging families in that in a more ongoing way helped to identify more specific, not only frustrations, but also more specific potential solutions. And it also helped caseworkers and administrators to some degree develop more understanding for the kinds of challenges that families were experiencing. So for example, I think when people, even though we may think, well, a family has already applied for one benefit program, it must make it easier to apply for the next one and the next one, that's not necessarily the case. And in some cases, families may feel or experience even more stigma by having to apply and reapply for multiple services. Understanding that perspective from these family consultants helped some agencies, staff think about, oh, how do we reduce that and not amplify or create more pain than is necessary with, and instead of putting it on the family to make that coordination happen in their own lives, how can the agency then take that on? So some of that then led to this next point, which is how could the families themselves be planning outreach in more coordinated ways? How do you plan outreach to families as part of the application and service delivery process? And also how, as part of this kind of continuous improvement effort, can program administrators be planning outreach to families so that they're hearing their insights and experiences before pursuing a change in practice? And all of that really led to kind of more conversation and thinking around how the ongoing staff, like caseworker or program administrator and family interaction, could be changed to be more of a feedback loop and less of a one-way interaction. And as a result, we found that this was kind of a good, we had just gotten to the point of identifying key insights from families that these pilot agencies were then interested in applying in their work going forward. So we look forward to hearing what they do and what you do as part of your work when you're pursuing similar coordination challenges. The blueprint process of mapping things out step by step for each of the actors, from families to frontline staff to program administrators, proved to be a really helpful practical process step. And there are many other sort of process steps like that outlined in the toolkit that in those modules that Lisa described. So we look forward to hearing your questions, feedback, and thoughts about the toolkit. Here is a QR code to access it on the project website, and I will turn it to Kate for closing comments.
Thanks so much, Reka. I want to thank all of our presenters today, and I also would really like to extend my gratitude to the large team that contributed to this project. You only see 4 of us here today, but there were quite a few staff at MEF Associates, the Urban Institute, and the Adjacent Possible who contributed to this project. This presentation really boiled down an enormous amount of work and thinking, but there's much, much more to explore than what we've previewed today. You can find the toolkit and other materials on MEF's website, which is accessible via this QR code or by visiting mefassociates.com. I also encourage you to reach out for more information or with questions. You can see my contact information there as well as Lisa's. You're also welcome to reach out to any of the folks who participated and contributed on this project. So thanks so much for tuning in today. We really appreciate your interest. Hope you've had some great ideas sparked here and that we'll hear from you soon. Thanks again.